I want to now address adjustability of the band, but before I do so, I really want to focus a little bit on why the band is necessary. Why do weight loss treatments fail? If we have a look at this figure, you'll see here that weight regain is the issue and problem of all weight management programs. We have environmental factors, we have lifestyle factors, we have a lot of behaviours that are very difficult to change. But more than that, we have a physiological process that means that when we lose weight, we have a lot of things wanting us to put the weight back on. We decrease our metabolic rate, we increase our hunger, and we tend to put on weight. We also have the brain, which is controlling our weight very, very accurately, and it has a number of mechanisms to make sure that we do not sustain weight loss. This next figure shows a rat's brain, and it shows a lot of the pathways that influence energy balance. That is what our weight is doing. Importantly, the gut gives us short-term messages of satiation, stopping a meal, or satiety, that satisfaction after a meal. But when it comes to long-term weight loss, it's the fat and signals from the fat that are critical. The next figure shows the response in the brain to losing weight. In fact, when we're weight stable, we have two systems within the brain that regulate our weight. We have a short-term system called a catabolic system that's active when we're weight stable. When we actually gain weight after Christmas dinner or after a lot of celebrating, what we tend to do is this catabolic system is switched on, we become less hungry, and we tend to exercise more. So we exercise more, and this tends to put weight on. When we lose weight, however, this system is switched off and switched down, and we tend to be more hungry and exercise less. On the other hand, if we lose weight, we have an emergency system switches in, an anabolic system, which also causes, and it's a very strong system, causes us to be hungry and produces a number of important mechanisms that allow us to put on weight or force us to put weight back on. Next slide, I'll summarise some of those. When we lose weight and we take weight off as a result of reducing the body mass, we find that there's increased muscle efficiency. Our muscles work better. They're better at burning fat. We find that there's reductions in our body temperature. Our patients will tell us that they feel colder in winter after they've had a band and lost weight. There's reductions in the sympathetic nervous system activity, and there's reductions in thyroid activity. All things that would have us put on weight. The next slide shows us some brain perceptions have also changed. The perceptions of fullness after a meal are changed. It takes us more when we've lost weight to feel satisfied. Their perceptions of how much we've consumed change. You perceive that you've eaten less when you've actually eaten more. Our reward pathways to food are sensitized. We feel very good about foods that are pretty normal. Everything tastes great when you've lost weight. And there's an increased emotional response to food. This can be seen on brain scanning. We can see that there's an increased pleasure, excitement, and cognitive restraint is reduced. All of these things tend to lead us to put on weight when we've lost weight. In essence, the body is far better to position itself against weight loss than it is weight gain. And this makes sense because we really want to protect ourselves from starvation. In the past, we've never had to protect ourselves from dietary excess. The interesting thing is that there are many circuits within the brain to make sure that we don't lose weight and keep it off. So I'm really describing that weight loss is the perfect storm for weight regain. Weight loss is the perfect storm for weight regain, and therefore it's not willpower that's a problem with our patients putting on weight when they've lost weight. It is the physiology of them protecting their fat and protecting their weight. Now, When we look at this next figure as a study that we performed here in Melbourne with the band up and the band down, we took 17 subjects who had, for one test, the fluid in their band. They didn't know, we didn't know whether the fluid was in the band. And on the other breakfast test, the other morning they came along for a breakfast with us, they had the fluid out of the band. One in, one out. We didn't know, they didn't know whether it was in or out. They came along at 6:30 quietly. They hadn't exercised beforehand. We watched them over the next few hours and gave them a small lap band friendly breakfast at 9 o'clock in the morning. What you'll see here is quite interesting. When the fluid was out, they were hungrier. This is a visual analog scale, and very hungry is at the bottom and very satisfied at the top. And you'll see that at 7 o'clock, 8 o'clock and 9 o'clock, they were hungrier when the fluid was out of the band, less satisfied. So this is suggesting the band has worked all night and our patients are not particularly hungry in the morning. In addition to that, after the small meal, you'll see that when the fluid is out of the band, they're less satisfied by the meal, and by 11 o'clock, they're hungry again. So the effect of the band is quite dramatic. It reduces the hunger before a meal. It produces satisfaction immediately after a meal, but that satisfaction of a small meal is quite prolonged. It's important to recognise, you'll see this figure with all of the currently used conventional procedures for bariatric surgery. For the band, for the Roux-en-Y, for the sleeve gastrectomy, and the old vertical banded gastroplasty. They all have a common anatomical area that's affected. Just below the gastroesophageal junction where we put the band is critical to the action of all of these procedures. And it's important that we maintain the anatomy of that area to maintain their effect. So I also want you to understand that we're not calling this restrictive surgery. We have absolutely clear evidence that it's not restriction or over delay of food going through the pouch that produces this satisfaction and satiety. After all, those patients would have had no food in their stomach at 7 to 9 in the morning, but still had a remarkable effect of the band. These two studies by De Jong and Paul Burton here in Australia clearly show that it's not due to delay of food going through the band that produces this prolonged satisfaction effect. In fact, food should not accumulate above the band at any time. It should go through within a few minutes, and as the patient's eating, they should never feel that they've got a build-up of food. So it's not restrictive surgery. Food intake is not really delayed. It's another effect that the band is producing. The next slide shows the cognitive effects or the eating behaviour effects that one expects with non-surgical weight loss. We expect increased hunger, a reduction in cognitive restraint or emotional eating, and we see an increase in disinhibition, that is eating when there's food around or at social occasions, etc. That's the effect of non-surgical weight loss. When we look at the band, this work from Susie Collis shows that the hunger's reduced, there's increased cognitive restraint, in other words, less emotional eating, and more control when people are out at social occasions, etc. Completely the opposite to what we expect. It's quite a miracle that this occurs. So what we're looking for is satiation after a meal, that early satisfaction, and then that prolonged satiety, that prolonged satisfaction that you get with a small meal. We're not looking for restriction or obstruction. What we're looking for is the green zone. We don't want people hungry and looking for food, and we don't want people too tight. The key is to use the ability of the band to reduce hunger, both in the short term and the long term.